Dr. Savarda Khalsa with Living Wellness Medical Center, and I'm here with Dr. Lori Brouwer, and we're going to be talking a little bit today about testosterone therapy in men. So we have some questions that came in, questions that people have about testosterone treatment for men. At what age does testosterone start to decline in a man?
Well, I think a generally accepted age is right around age 40, but men that are younger than that are under tremendous amounts of stress, their testosterone can decline because of that high stress level. But on average, around 40, they start to decline. But a lot of men don't start to exhibit symptoms until they're 50 or 60, but by then, they've had many years of low testosterone and then the effects that has on your body.
Right, okay. And what are some of the symptoms you should be on the lookout for low testosterone?
Well, again, a lot of men don't come in until they start to have some kind of a sexual dysfunction, right? So they're having erectile dysfunction or a lack of libido or something like that. But the changes that come far before that can be anything from insomnia to aches and pains in their joints, having a lower tolerance for exercise, not getting as much out of their workouts. Their muscles are weaker than they used to be. Their cardiovascular fitness is lower than it used to be. I think those are the main things that we hear the complaints about is I'm tired, I'm exhausted, I'm not interested in life anymore, their mood can go down. And all that time, that's how they're feeling, but then they're having effects on their cardiovascular system. Their heart muscle can be weakening. There are a lot of reasons to start replacing it and start boosting it younger and not waiting until it gets all the way down to having poor erections.
Yeah, makes sense. Okay, and what are the differences between testosterone replacement therapy and steroids used in bodybuilding?
Oh, okay, yeah. So testosterone replacement therapy is a replacement therapy, right? As men age, their testes don't produce testosterone that well. They're missing out on this hormone that's really vital for their proper functioning. So we're replacing something that's missing or that's very low. Where, using steroids that are either like an artificial testosterone replacement that's kind of a chemical that mimics testosterone, very different effects on the body. It's not replacing something that's natural to the body, it's pushing the body with something that's fake. Those things can, result in really high levels that can cause, like roid rage, right? They're really irritable and aggressive and their testicles shrink away. And, there's a lot of really harmful effects of that kind of steroid use that's just not the case with replacing real testosterone.
Yeah, makes sense. Okay. And what are the conventional versus optimal lab goals? So many times we hear a patient say their labs are normal. So what does that really mean?
Oh yeah, this happens all the time. I get men that come in and they're in their 40s or their 50s or 60s and say, I'm just not feeling like myself. I'm not feeling well. I'm tired. I'm not as strong as I used to be. All of those things we talked about before. But my doctor says my testosterone's normal. Well, there's normal for your age, right? So when you're younger, men in their in their teens and their 20s and 30s have these really high testosterone levels, and it's keeping them strong.
Yeah.
And as that starts to decline, the reference range changes per age, right? So men in their 20s, there's a reference range for them. That's the normal range. 30s, 40s, and so on. So if you're in your 50s and you have a normal level for your age, that's much lower than when you were younger and stronger.
Right.
So I don't want my elderly men to be necessarily in the normal range for their age. I want them to be more normal range for like a 30-year-old. And that's based on all the studies, right? That's not just my personal preference. The studies of men using testosterone replacement therapy tells us those more youthful levels are what's going to keep them stronger.
Right.
So for instance, a lot of doctors will just look at the total testosterone. So there's a couple ways to look at it. And you can look at the free testosterone, which is what's available for the cells to use. And then there's total, which is a lot of that's bound up and not available.
Right.
So just measuring total testosterone doesn't really tell us how much of that is usable by the body. And even in that, a lot of men, when they're under 1,000 in their total testosterone, they're feeling symptomatic of that. Again, they're not sleeping well, their energy is poor. So I don't care what your total is, and I don't care that you're normal for your age. I want you to be in that optimum range of free testosterone as if you were younger.
Makes sense, yeah. All right, so thank you for answering those questions. All of the doctors here at Living Wellness Medical Center offer a 10-minute free phone consultation where we can chat a little bit with you and just make sure it's a good fit. So give us a call at 480-588-6856, or you can visit our website at livingwellnessmedicalcenter.com.